So my name is Dr. Lydia Balchunas. I'm an optometrist and the project manager of the Low Vision Clinic, which is a professional medical office. And the staff of our two departments includes 2 optometrists, an optician, occupational therapist. We have a medical receptionist, a wearable technology trainer, low vision specialist, and a manager who oversees the needs of both the Low Vision Clinic and the Eyedea shop. So there are different types of eye exams. There's the kind of traditional or medical eye examination. This is where there's dilating drops, diagnosing of eye diseases, treating conditions, surgery if needed, basically addressing the health of the eyes. And then there's also the vision rehabilitation assessment, which is what we do here in the Low Vision Clinic, where the focus is on function and using the remaining vision as effectively as possible, basically to keep the patient safe, independent, and like doing the things that he or she really want to be doing. And these two types of eye exams are really a complement to one another. And in fact, most of our referrals do come from other eye doctors. So I would say that in a nutshell, our job in vision rehabilitation is to help our patient clearly set their goals and then to help them meet their goals with tools and training and referrals. So we already know the diagnosis of their eye disease because we have a copy of their exam notes from the referring eye doctor. And I really see this work as a series of partnerships with the patient, with other Cleveland Sight Center specialists, and with the referring eye doctor. So a very important part of the low vision examination, or the vision rehabilitation assessment, we use those two terms interchangeably, is goal setting. So, and a lot of times patients will say to me, you know, doctor, I just really want to see better and I want better glasses. But this really is not a very productive goal, and so much of our work really is just managing expectations and pointing to realistic outcomes. So I might ask a patient, well, what specifically are you no longer able to do that you really want to be able to do and that you want to partner with me towards that goal? Or I might say, you know, what are your top 3 goals? And it could range from measuring insulin, paying bills, driving, seeing the bird feeder. The list really is endless. So, so setting these goals really starts that vision rehabilitation assessment or that low vision exam. And then we'll always also do a refraction if the patient's interested for glasses. And then we'll explain why glasses can help, but they do not solve everything. We provide glare control assessment, lighting and contrast enhancement. We'll address peripheral vision deficits, and then there's counseling. And it's not just rehabilitation options, but a lot of people really feel that they don't understand their eye condition. They don't understand where in the eye the damage is, why glasses can't help. So we spend a lot of time answering these questions, and I have this big eye poster on my wall, and I'll take it off the wall and the patient and I will look at it together, and I'll show them exactly where their eye disease is. So it really helps them to understand. You can see them just relaxing that, okay, I get what's going on, and it helps them then move forward in the rehabilitation process. Then we do a lot of referring to other Sight Center departments, and for me, this is just critical to be able to refer to other specialists, because so often the low vision exam is just the start of the rehabilitation process. We'll also address financial limitations regarding our services, and then we send a detailed outcome letter to the referring doctor. So that's a typical vision rehabilitation assessment, low vision clinic exam. So what makes a good referral to our clinic? So basically, well-defined, clearly established goals, and we can work on this with the patient for sure in the exam room, but it really helps if they have clear goals, and then a measurable functional improvement as we work with the patient. And that's because this is really the best recipe for success, And because really insurance companies will not pay for services if there's no functional improvement. Just like any rehabilitation service, like post-stroke, if there's no improvement, they will not continue to pay. So now what I'd like to do is introduce you to some of our patients so you can experience how Low Vision Clinic serves them and how they use Eyedea Shop products. So I'm going to share some of my PowerPoint slides. Okay, so this very kind gentleman came to see me diagnosed with macular degeneration. In his right eye, he could barely see light, and the left eye, he had to be 3 inches from this chart, and he could barely see the top letters. And he was a minister, he was working mostly by phone, and he wanted to get back out into the community and church setting. His goals were seeing his cell phone, reading handwritten letters, and watching TV. And he was told by his doctor not to bother with glasses because they won't help. And he also wanted me to know that he was on a fixed income. So I referred him to Cleveland Sight Center's rehabilitation teachers to help him with activities of daily living in his home. And they went to see him through the Independent Living Program, which is a funding source for the service, so that was paid for. And then I did end up prescribing glasses, and they were helpful. He still wasn't able to read more than the large letters on the chart, but he was able to sit now 3 feet back from it, not just 3 inches. So he was really happy that this visual range expanded. It was a much more comfortable social distance to talk to his parishioners, to watch TV, do things around the house. Up close, he wasn't able to read a near chart at all, but with the glasses prescription, he was able to read large print at a comfortable 13-inch distance. So he was very happy with that as well. And then I recommended this 8-power handheld magnifier. You see him reading his flip phone with it, and here he's reading his handwritten letter from a parishioner with that magnifier as well. So we often use, when we do our refractions, we often use this trial frame, and that's to increase accuracy. It's a lot easier than sitting behind that 4-opter for patients. We also use these high contrast charts. You see some of them behind me here. And we provide enough time. These low vision patients have a hard time telling those differences between lenses. They need more time. And we have a very skilled optician, and he provides excellent products and packages so that patients can get really good products that are affordable for them. Okay, this lovely lady was diagnosed with ocular toxoplasmosis, which was caused by a parasite, and it caused scarring in her macula, so her central vision was affected. And she could not see clearly straight ahead. And she was wearing very old telescopic spectacles, and they were falling apart. And so she asked me to replace that system. She was a very active woman. She had a lot of very specific goals, using her computer, seeing the scrolls on the television, and reading her smartphone. So she's left eye dominant, so I did prescribe new glasses and refit her with a new design of a 6-power bioptic telescopic system for her left eye. And here we see her husband always attended the visits with her and always was dressed up to the nines here. And so through her new glasses, she could see 2350, which is that big Z in the chart. But through the telescope, she could see all the way to 2040. So that's like just 3 rows off the 2020 row. So much better through the telescope. And then up close, she could see 2025. And then with this lens cap that I prescribed, she was able to even read the fine print on her smartphone in 2020. I also recommended, though, a portable digital magnifier for prolonged reading, like a newspaper, which allowed her to read much more quickly than with the telescope. And I referred her to our occupational therapist, for training with digital magnifiers, and also for smartphone accessibility and training with apps. Now this was a very interesting case. This woman came in with a diagnosis called hemiplegic migraine, which is very rare. I had never heard of it. She said that it was triggered for her by the flicker of fluorescent lighting, and in very short order it would cause right side of the body spasticity, and it would last for 5 hours to 2 whole days. She also had difficulty processing numbers and dates, decreased comprehension, difficulty speaking. So it was really just like a stroke. So I went ahead and I searched the literature. I called Johns Hopkins Rehabilitation Service, and I was like not finding any answers for this condition. And she did have specific goals. She wanted to pursue employment, office work, if she could minimize these episodes. And what's very interesting is that her vision was actually normal. She was 20/20 in each eye, full peripheral visual field, so normal vision. So is she a good low vision candidate? Her symptoms, she said, were increasing. She was having these episodes 1 time a week. And we witnessed it here in our office, because she was triggered out in our lobby. For 5 minutes she was out in our lobby checking in. When we got her into the room, we turned off all the fluorescent lights and just used our incandescent ones. But it was really too late, so by the end of the appointment, she was crying, and she limped out of the office holding her useless right arm. So despite perfect vision, this woman had profound disability related to her eyes, and we really wanted to help her find a way for success. So we did find some things that helped. We tried a variety of filters and tints, and I recommended 2 things. There's a proprietary pink tint called FL41, and it allowed her to recover from migraines more quickly. And then she said she could zip in and out of a store without triggering. And then I also recommended this prescription lenses in this tight wrap frame that's pictured here in my slide, with blue light anti-reflective coating, and she said it worked very well, allowing her 20 to 30 minutes in fluorescent light settings. And then later I received a letter from her, and she said that she was at day 22 without hemiplegic migraine, and it was the longest stretch in 5 years. So that was a really, really enjoyable experience working with this condition and this lovely lady. And now here's another lovely lady. This is a much beloved previous employee of Cleveland Sight Center, and she and her twin sister were born prematurely. So the diagnosis is retinopathy of prematurity. So although oxygen therapy is necessary for underdeveloped lungs of premature infants, it will cause disorganized growth of the blood vessels in the retina. And that can cause scarring and retinal detachments over time. So she really was doing quite well for a while, and then in the course of 1 year, a lot happened to both eyes. Her right eye, she ended up having a spontaneous total retinal detachment, and that became a painful eye with high pressure, so it needed to be removed, and she had a prosthetic placed in that eye, so no light perception, total blindness. And the left eye needed cataract surgery. She had a dense cataract, and unfortunately she had a complication after surgery, and that retina detached as well. And so that eye was just hand motion at 1 foot away. So at this point, her vision is quite poor, but she still came in for low vision services. She said she was experiencing a lot of glare sensitivity, even with the poor vision. Indoors, outdoors, she was having nausea and headaches. And she was also interested in evaluating smart glasses, which is a wearable spectacle device with a smart camera that has OCR, optical character recognition, which can read a document, it can recognize a face. So first we addressed the glare issues, and we found a specific red tint that alleviated these symptoms of the glare and nausea and headache. And then we had these bonus unexpected results. When she was sitting in my exam room, she looked at this door and she said, wow, I can actually see where the outline of the door is, so now she can get in and out of rooms and navigate much better. And then when we were outside, and she said, wow, I can see the yellow line of the curb of the sidewalk where the step down is. So she felt also safer with mobility and not having to rely quite as much on her guide dog. And then I referred her to our technology department, and we see here pictured one of those smart glasses with the camera attached to the temple. And then the last patients I'm going to introduce you to are these two teenaged young men who walked through our doors literally within 6 days of each other. And so this allowed us the opportunity to introduce them to each other and create a tailor-made support system for them, which was done by our social workers in the case management department. So each of them had severe advanced glaucoma. They each had college and career goals. They needed significant support from many of our departments, and each of them had severe tunnel vision, almost like looking through a straw. So here's a picture of one of their visual field results. So a normal visual field, I'd say it almost takes up this entire grid, kind of like an oval. And the visual field of this young man was very small. Here you can see how it's represented, almost like looking through a straw. So for recommendations, so first thing we wanted to do was orientation and mobility. So I referred them there for long cane training, because safety is important, being able to travel and be independent. Career goals, I referred them to our employment services department. I addressed glare issues, referred them to several of our departments for smartphone apps and accessibility training. I provided magnification for their reading goals. Here's an example of one of the magnifiers we have at the Eyedea shop. And then we're providing ongoing support for these young men as needed. So regarding the Eyedea shop, I know many of you have toured the Eyedea shop and seen many of their products, and I've shown some samples here. They are actually the largest low vision retail store. They're open from 9 to 5, Monday through Friday. They've shipped to 49 states. They have a large selection of assistive technology department. They provide demos for head-mounted gear here at the agency. And then they can provide in-home demos of traditional digital magnifiers. And they also have a very popular holiday greeting cards that they sell annually, and they're all created by low vision artists. So to briefly summarize our challenges and goals, I would say that really visibility and referrals, kind of basically making sure that the people who need us get to us is one of our kind of challenge and goal. And then how to best help our patients come to the appointment prepared for success and to know what to expect of the appointment. Certainly keeping up with changes in the field, technology, replacing old equipment. That visual field machine we have, it's actually a dinosaur and it's on its last legs. We were told that it can no longer be calibrated and that the filters can't be cleaned. So I spoke with our fundraising department, and they just told us 2 weeks ago that they were able to come up with a grant to purchase that machine for us. So we're going to be getting a new upgraded visual field machine, and we're very happy about. And then, of course, just to continue to increase the value of our service, what we do, how we do it, and patient experience. And in closing, what I really want to share is just how much I feel Cleveland Sight Center is a jewel in Northeast Ohio. I've been here for 30 years. I've seen quite a few wonderful people come and go, and each one contributing something important and unique. The culture at this agency is really strong. It's strong and supportive. We have a place here where we can challenge ourselves, learn new skills, create potent collaborations with each other, and enjoy the process. So I see, and I have seen this as significantly up-leveling the care that we've been able to provide our patients. So I hope we continue to maximize this capacity to provide expanded value. For me, it's a distinct privilege to be a part of this community, and I thank you so much for your support of us, and I hope this information was valuable for you.